Hello everyone, and welcome back to your daily dose of medical news. Today is Friday, February 20th, 2026. We have a packed schedule today, covering a massive regulatory shift in the FDA, a new weapon against leukemia, and shocking news on how we treat chronic pain. Here are the top headlines for today. Cancer treatment. A new combination treatment approved for chronic lymphocytic leukemia. Pediatric alert. Why a parent's gut feeling is a better indicator of severe child illness than symptoms alone. Tech and research, a new AI-driven CRISPR tool to combat antibiotic resistance. Headline 1. New leukemia treatment approved. On the approval front, the FDA has officially approved a new combination treatment for previously untreated patients with chronic lymphocytic leukemia, or CLL. The combo consists of the established drug Venclexta, or venetoclax, paired with the newer agent acalabrutinib. This, in theory, offers a more potent, targeted approach for patients at the start of their treatment journey, helping to reduce reliance on traditional chemotherapy. This combination aims to improve long-term progression-free survival rates in CLL, which remains a prevalent type of leukemia. Headline 2. Gut feeling saves lives. Moving to pediatric care, a groundbreaking study published this week in JAMA Network Open has revealed that doctors should trust a parent's gut feeling more than they previously thought. The research found that if a parent has a clear, strong concern that their child is seriously ill, they are right about 90% of the time. In fact, simply asking, "Are you worried about your child?" works better to identify serious illness than a comprehensive checklist of symptoms. Experts say a worried parent should never be ignored or asked to wait it out, as parental concern is a significant warning sign that needs immediate assessment. Headline 3. CRISPR AI and antibiotic resistance. On the research side, a breakthrough CRISPR tool is promising a new way to combat the growing antibiotic resistance crisis. Researchers have developed a conjugal gene drive-like system that targets antibiotic resistance genes located on plasmids, the small DNA molecules bacteria use to swap resistance. This tool doesn't just kill bacteria, it reverts them, making them sensitive to antibiotics again. Even better, the system functions within biofilms, those dense communities of bacteria that are notoriously difficult to treat, which are responsible for many chronic infections. This marks a major step forward in creating a new generation of bacterial-aware medicine. Mid-CBD stricture immediately after cholecystectomy. A mid-common bile duct, CBD, stricture occurring immediately or shortly after a cholecystectomy is almost exclusively caused by iatrogenic injury, damage during surgery. While some strictures develop over months, early postoperative strictures, often within 1 to 4 weeks, result from direct surgical trauma or its immediate consequences, and up to 20% of such injuries are recognized at the time of surgery, while many present within the first week. Primary causes of immediate mid-CBD stricture. Misplaced clips or ligation. The most common cause is the inadvertent clipping or ligation of the CBD during the attempt to ligate the cystic duct. Thermal injury/cautery burn. Extensive use of electrocautery near the bile ducts can cause delayed tissue necrosis and subsequent stricturing of the duct. Fibrosis from misidentified anatomy. Misidentifying the CBD as the cystic duct can lead to partial or complete ligation and transection. Ischemic injury. Damage to the small blood vessels, devitalization, feeding the bile duct, particularly during extensive dissection around the triangle of Callot, can lead to narrowing. Inflammatory reaction. Intense inflammation, e.g., from acute cholecystitis or an adjacent bile leak, biloma, causing extrinsic compression and subsequent scarring. Other potential causes, less immediate. Moritzi syndrome. A gallstone impacted in the cystic duct causes compression and, in some cases, necrosis of the adjacent CBD, causing it to stricture. Retained stone/stump. A stone remaining in the ductal system or a long cystic duct stump that becomes inflamed. Symptoms and diagnosis. Immediate postoperative strictures often present with jaundice, abdominal pain, fever, or signs of cholangitis. Diagnosis is typically confirmed via magnetic resonance cholangiopancreatography, MRCP, or endoscopic retrograde cholangiopancreatography, ERCP, which may show a narrowing of the bile duct. Management. Early, non-complete strictures are often managed with endoscopic stenting, while severe injuries, complete transection or ligation, often require surgical reconstruction, such as a Roux-en-Y hepatocogenostomy. Rapid fire round. Quickly before we go. Physical activity. Regular leisure-type physical activity was associated with a reduction in the risk of dying from 7 types of cancer not previously studied extensively. The impact of physical activity on cancer mortality varied by type of cancer and level of physical activity. Patients who were inactive before diagnosis of lung or rectal cancer had a significant reduction in mortality risk if they performed regular physical activity after diagnosis. MedPage Today. Baby foods. Over 70% of baby food products could be considered ultra-processed foods, a study in nutrients suggested. MedPage Today. Post-laser fungal keratitis. 3 patients developed fungal keratitis infections linked to laser eye surgery at a single ophthalmology clinic, and 1 required a corneal transplant. The culprit was Purpureocilium lalacinum, an environmental mold that has been increasingly detected in recent years. Proper infection prevention and control is crucial in laser eye surgery clinics, and ophthalmologists should be aware of the risk of this fungal infection. MedPage Today. That's your medical news update for today. Remember to consult a healthcare professional for any medical concerns. Stay informed and stay healthy. Don't forget to like and subscribe for more daily health insights. Disclaimer: use the content after verification.